So we see increases in rapidity of emotional onset, we see increases in intensity of emotion, and we see increases in duration of emotion. So when you put these three things together, you have a child who's growing up and gets angry faster, gets more angry and stays angry for longer. You have a child who can't restrain their impulses, and you have a child who has difficulty focusing or paying attention. Today, we're going to talk about ADHD as a neurodevelopmental diagnosis. And this is really important because if you have a child with ADHD, the key thing to remember is that their brain develops over the course of them growing up. Now, I almost certainly have a kid who has ADHD, and working as a psychiatrist, I'm sort of looking at my daughter and recognizing that because her brain is different in some ways, that she has some difficulties in life. And this is really sad, but this is sort of what the research shows. If you look at a population of people who have ADHD and depression, what we find is that there is a causal relationship between the ADHD and the depression. So 3% of kids who grow up depressed or have a diagnosis of a mood disorder will develop ADHD later in life. But 70% of children who have ADHD will then go on to have depression later in life. And if we look at this, the reason is actually really, really simple. It's because their brains are designed in a particular way, and the society that they live in is not designed for their brains. So if we kind of take a couple of examples of this, and let's remember that ADHD basically has three hallmark features. The first is difficulty with attention, or an impaired attention. And remember that this impaired attention means two things. It means the inability to focus on something when you need to, but also the inability to shift your focus away from something when you really should be concentrating on something else. So they're highly distractible and also can be highly perseverative, which means that they're focusing on something and they should be paying attention to other things. It's time to put down the video game or put your book away and get ready for school or get ready for bed. So they have difficulty in both ways, right? They have difficulty keeping their attention in one place, and their attention stays too long in one place, and they have difficulty shifting it away. The second hallmark of ADHD is impulsivity. So this means that when they do have some kind of impulse, which we have all the time, right? So when I'm sitting there trying to read a book, my mind will have an impulse to check my phone, or my mind will have an impulse to use the restroom, but I can restrain that impulse and focus on the task at hand. Kids with ADHD have difficulty with this impulsivity. The third thing that they struggle with is emotional regulation. So we know that the brains of children with ADHD are a little bit different. So we have this part of our brain called the amygdala, and related to that is the limbic system. So the amygdala is where we experience things like fear and anxiety. It is the survival center of our brain. And then the limbic system is the broader emotional circuit. So if you look at a neurotypical brain, what you find is that we experience some degree of emotion, but compared to a kid with ADHD, the child with ADHD experiences emotion more rapidly. The second thing is that the intensity of the emotion is higher in kids with ADHD. So they feel the emotion faster and they feel more of it. So I may get 50% angry, but if I have something like ADHD, I may experience 80% anger from the same event. The third thing about kids with ADHD when it comes to emotional regulation is that the duration of their emotion lasts longer. So we see increases in rapidity of emotional onset, we see increases in intensity of emotion, and we see increases in duration of emotion. So when you put these three things together, you have a child who's growing up and gets angry faster, gets more angry and stays angry for longer. You have a child who can't restrain their impulses, and you have a child who has difficulty focusing or paying attention, or alternatively focuses too much and the teacher or friends or parents can't get their attention. So what does this result in? This results in the development of something like a mood disorder over time. Now let's understand very quickly why this is. Because now I have a kid who is not paying attention in school, right? They're getting highly distracted. They can't focus on what the teacher is saying. So their grades are not as good. They get yelled at by the teacher more often. People express a lot of frustration with them. And we know that, generally speaking, in society, we place the value of a human being based on their academic or professional performance. So if you have a child who gets straight A's, everyone is like, great job. You know, you're so smart. You're so great. We all love you so much. Here's a reward. Whereas if you have a child who gets C's or B's or D's, you get these kinds of statements of, if you only applied yourself, or if you tried harder, Or we don't understand why you don't just sit down and focus. You just need to focus. So from a very young age, kids with ADHD can tell the difference between good academic performance and bad academic performance. And as they have difficulty with academic performance, they start to develop a self-esteem based on their academic performance, because that's what we all sort of value people for, right? So when someone says, oh, like Dr. K, you trained at Harvard Medical School, that is a respectable thing. And so the more we achieve, the more respect that we get from people around us, and therefore our self-esteem rises. So kids with ADHD struggle this way. They have a lower self-esteem, which predisposes them to things like mood disorders and depression. The second thing, when it comes to impulsivity, this also affects things like their social relationships. Because when we play in the playground, there's a line of 4 kids who are using the slide. So when a neurotypical kid rides the slide, they come back down, they return to the end of the line. But the kid with ADHD is impulsive. So they ride down the slide, and then what they do is, that was so much fun. Remember, they experience the intensity of emotion greater, which also means that it affects their dopamine circuitry and their positive emotions. They're so excited when they get to the bottom of the slide, yet they cut right to the front and they want to go again. And they don't have the ability to sort of think about other kids. And so this results in problems in their social development, especially at a young age. So one study, for example, showed that by the 2nd grade, a child with ADHD will be invited to 0 birthday parties. And why is that? That's because when parents ask their kids, who do you want to invite to your birthday party? They don't want the kid with ADHD, because that kid always cuts in line, so I don't even want them at my birthday party. So this creates social problems, which will then predispose us to depression. And the last problem is emotional dysregulation. So these kids will get angry, they will get fearful, they will get anxious, which in turn impacts their social relationships, impacts their experiences at home. And so this is sort of what we see with the development of things like mood disorders later in life. So now I have a hypothesis, which is, so I have a kid who probably has ADHD. And we're in the process of formally testing her, but I'm a psychiatrist, so I kind of know what it looks like. And I see that she also has these difficulties. So she's highly impulsive, she gets hyper-focused at times, and is really, really hard to shift her attention away to something else, or she has difficulty focusing on what we tell her to focus on. And that can manifest with problems like she doesn't listen. So as a parent, what can I do about this? So I have a theory that if we look at something like these neurodevelopmental challenges that kids have, can I train my child? Can I actually give them particular exercises to strengthen the parts of their brain that are struggling? Can I help my child by teaching her specific things that we don't teach normal kids and therefore are not a part of regular parenting? Can I correct these deficits and then give her a more normal childhood? This is something that is really important to me because I have a kid with ADHD and I want her to grow up with the best chance to have a positive self-esteem and to be resilient against things like mood disorders later in life. So the short answer is, I don't know, but it is important enough for me to try. So I've done this stuff as a clinician with adolescents and adults, right? So we teach patients with ADHD certain mechanisms like meditation or coping skills or whatever else to try to buffer against the consequences of their neurodiversity, from the consequences of their diagnosis. And so we know from studies of cognitive behavioral therapy or ADHD-specific psychotherapies that if you do therapy with them for about 6 months, for 2 years after the therapy is over, their symptoms of ADHD are under control. So you can literally teach an adult how to live their lives so that their ADHD is in remission. Now, when we're talking about kids, there's a developmental component, right? So my daughter's brain is developing as we speak. Every single day, it is growing. It is learning. There are new neuronal connections being formed. There are neuronal connections being pruned. That's most of actually what happens in neuronal development. So I'm in the process of developing a curriculum for my daughter to protect her against the negative aspects of ADHD. So this is what I'm going to share with y'all. So I've come up with a set of exercises, which I do with my daughter, which work really well, and we're going to explain what those are. So the first thing is attention. So one simple consequence of the difficulty with attention is that kids with ADHD get yelled at a lot. So let's understand what's going on neurologically. The attention in my brain is governed by my frontal lobes. So the front part of my brain is what allows me to direct my attention. So if I want to focus on you, I can focus on you. If I want to focus on this plant, I can focus on this plant. If I want to focus on this piece of paper I have here, I can focus on the piece of paper that I have here. So this is done by the frontal lobes. And the challenge with kids with ADHD, one of the reasons they get yelled at so much, is because the stimulus that is required to break into their attention is so high that it triggers a stress response. So I'll give you all a simple example, okay? So let's say that I want your attention. So what do? I call your name. So I say, hey, your name, hey, can you help me with this? Now, normally when I speak, I use a certain volume, right? So I use like a regular level of volume. And then when I use your name, your brain is wired to pay attention to that name. You're not consciously aware of it. And then it sort of your brain brings this to your attention. So what we also know is that the ability to get someone's attention is variable. So this changes a lot actually when we become parents. So you all may notice this, right? So once you become a parent, your brain becomes hypersensitive to a child crying. Even your child crying very, very faintly at like 5 to 10 decibels at the other end of the house breaks through your attentional barrier and grabs your attention. So even as a parent today, what I've noticed is I'm not only sensitive to my children crying, if I'm at the playground, my brain will be able to detect a very, very quiet child crying off in the corner far away, and my brain is like, oh my God, there's a child who's crying over there. So now let's take a look at a kid with ADHD. So their attentional barrier is very high. They require a very strong stimulus for their frontal lobes to notice that something is going on. So what do parents end up doing? We increase the size of the stimulus. And the way that we increase the size of the stimulus is by yelling, right? So we'll say, hey, kid, hey, I've been calling you for so long. And we start elevating our voice. And because why do we do this as parents? It's not because there may be some degree of frustration, but what we learn as parents is that I require this volume to get my child's attention. And this is what's so challenging. I have to yell to get their attention, but anytime I yell, they also feel afraid because that part of their brain is actually completely normal or even hypersensitive. So now we're stuck in a situation where I have no choice but to yell at my child. So what we're going to do is train the brain so that they respond to us. And the way that we're going to do that is with a practice called Eyes on Daddy. So the cool thing about the brains of kids with ADHD is that the habit circuitry is completely intact. So this is why structure becomes really important. We'll get to that in later lectures. But what we're going to literally do is train our child by saying Eyes on Daddy. So I'll kind of look at her and I'll sit down with her and we'll sort of do this in a 5-minute span where I'll say, okay, kid, what I want you to do, my daughter's name is Avi. So I'll say, Avi, I want you to look at Daddy for 5 seconds. So Daddy's going to say Eyes on Daddy. And whenever I say Eyes on Daddy, I want you to look at me and I'm going to count to 5. So literally what I'll do is I'll say Eyes on Daddy. 1, 2, 3, 4, 5. And if she can hold my gaze for 5 seconds, that's when she's done a good job. So when I started out with this, she could hold my gaze for maybe 1 or 2 seconds. Okay. So Eyes on Daddy, 1, 2, and then she like looks away. So then I say Eyes on Daddy, 1, 2, 3, and then she looks away. Eyes on Daddy, 1, and she looks away. Eyes on Daddy, 1, 2, 3, 4, 5, and that's when she's done. So we'll train this over the course of maybe about a week. And what the cool thing is that once this habit kind of comes in, now it's kind of like her brain has been primed for this stimulus. And now when I want her attention, instead of yelling at her, I just say, Avi, Eyes on Daddy. And it's amazing. It's like her attention just swivels over to me like so quickly. And now she has my attention. So as a parent, I find that it's very, very helpful to smile at my child and sort of feel whatever love that I can, right? So I'm getting a chance to sit and look at my daughter and we're like looking at each other, which is fun. And then we can also kind of make it fun for her by smiling or even playing a game. Or the second that I get to 5 or right before, this is one thing that I really love to do. I say Eyes on Daddy, 1, 2, 3. And if I think she's going to make it, I'll look away and I'll move over here. And then she starts to laugh. It's really weird, but that's just how it works. So we can use this technique of Eyes on Daddy or Eyes on Mommy or whatever phrase you want to use. We'll also use other attentional words. So we'll have kind of these like special words like pixie dust or other kinds of things that this is what my wife kind of does. She comes up with special words for each child. So this is our magic word, which means that we really need your attention. So Avi's magic word is pixie dust. So whenever my wife wants my kid's attention, she'll say pixie dust. And Avi has been trained to look at my wife anytime she says pixie dust. And this removes the need to yell at our daughter to get her attention. Works really well. Strongly recommend that y'all try it. Okay, so let's take a look at another skill that we want to train in our kid. So this is going to be protecting against the impulsivity. So let's start with understanding the neuroscience of impulsivity. So we have impulses in our brain. So we have a lot of different parts of our brain that want us to be doing things all the time. So right now it's a little bit before lunch, so I am hungry. And my stomach is sending signals to my brain that, hey, we need food. And so then I have these kinds of thoughts about eating, but I'm restraining that impulse. So if we look at the brain, all kinds of things are sending signals to our thalamus, which is our sensory gateway. So this is sort of the sensory input center of the brain, where we get all these sensory inputs from our eyes, our ears, even proprioceptive or visceral signals like hunger or thirst. All of this stuff goes into the thalamus. And then we also get emotional signals in the brain. We get signals in the brain from things like motivation, desire, anticipation. So like when I want to play a video game, that's not coming from the thalamus, that's coming from this place called my nucleus accumbens or my striatum. The key thing is that all of these different parts of the brain always want to be doing something, right? So they're always competing for our attention. Should I play a video game or should I eat? Do I need to use the bathroom or do I need a drink of water? Do I need a drink of water or do I need some caffeine? Do I need some caffeine or do I need some tea? Do I need some tea or do I need a beer, right? So all of these signals are constantly bombarding your brain. And it results in the frontal lobes having to make a decision. So all these signals get integrated, and then ultimately, your frontal lobes hopefully make the right choice. And what we know is that the stronger your frontal lobes are, the more of the right choice you will make. So now the question with kids with ADHD is their situation is that they have difficulty controlling their impulses. So whereas you or I may have an easier time making the right choice, it's really hard for my daughter to make the right choice. If she gets an impulse, she has very little ability to control it. So the question becomes, how can we train her ability to restrain her impulses? Very easily, through practice. So this is where I use a couple of almost like meditative techniques. So this isn't real meditation, but if we look at sort of the science of meditation, it has a couple of pieces. And one of them is impulse control. Now, the challenge is that it's really hard to get ADHD kids to meditate unless you break up the steps into meditation into fun activities that you can train. So we're going to use two forms of impulse control. One is a game that I called Sniffer Gobbler, and the second is a game that I'm going to do that's called Wet Willies. So if y'all are kind of my age, you may know what a wet willy is. It's when you stick your pinky in your mouth and you stick it in someone's ear canal. Okay, so we're going to use these two games and we'll show you how they work. So in Sniffer Gobbler, what happens is she lays down and I am a monster called a Sniffer Gobbler. So she has to lay down with her eyes closed and the Sniffer Gobbler comes and sniffs you. And if you move at all, it gobbles you, which means I basically tickle her. So if we look at over the course of this game, what's happening is I'm going to try to tickle her a little bit and what she has to do is try to remain perfectly still. So let's understand what's going on in the brain at this point. So as I do little movements or whatever, right, as I increase the anticipation, I don't know if you can imagine what it's like to lay down with your eyes closed and someone else is sniffing you or tickling you. You want to move, right? And even the fact that we do it with the eyes closed makes it harder. So anytime we have our eyes closed, if you're kind of getting tickled and you think about it, having your eyes closed makes things way scarier, makes things way harder to control because then you're kind of primed and even a slight touch will tickle you a lot. Will create a big signal. So what we want to do is actually increase the size of signals that are impulsive in her brain. And then in this moment, the whole point of the game is for her to stay perfectly still. So what she's literally doing is training her brain to resist impulses. So we'll play Sniffer Gobbler. It's really important to make this stuff fun, right? So the other challenge that we run into with ADHD is that so much of the stuff that we want our kids to learn is in the form of punishment. So it's you need to do this better. You need to listen. You need to do this. I'm going to punish you. You're doing a bad job. And until you do a good job, we're going to take this away, take this away. We try to motivate our kids through punishment, but we don't need to do that. We can just simply do it by creating the right kind of exercises from a neuroscientific perspective that correct the deficits of a child with ADHD. So Sniffer Gobbler is a great example. So after we do sniffer gobbler, she has some practice at restraining her impulses, and kids will get tired of it really quickly. The other really cool thing about kids with ADHD is that in my experience, they learn way faster. So you need more exercises. So recently we started doing wet willies. So that what I tell her to do is I tell her to adopt a meditative position. So she's sitting cross-legged with her arms out with a mudra. And then what I'm going to do is while she's meditating, I'm going to try to distract her. Right? So what I do is I get a glass of cold water. I dip my pinky in it, right? Because we don't want to use saliva. That's not really sanitary. And then if you do those kinds of things, then she's going to be giving kids wet willies, and we don't want to do that. So we're going to use a glass of cold water. I dip my pinky in it, and I stick it in her ear. And then if you've ever gotten a wet willy, you know that you really want to cringe and move away. But the whole point is that we're going to train her impulsivity. So she has to be able to restrain that impulse. And then the fun part of this as well is after we do wet willy on one side and wet willy on the other side. So now we're going to switch positions, and now daddy's going to try to meditate and you can wet willy me. And she absolutely loves this, right? She loves wet willying so much. It's such a fun game for her. And the cool thing is we are developing her brain in the right way to correct for those neuroscientific deficits. The third thing that we're going to focus on is emotional regulation. So this one has taken me a little while to sort of figure out. So it took me maybe about 6 months to develop practices for disordered attention and maintaining your focus. And those are working really, really well. Y'all will hopefully see in some of the videos, I was hoping that I could have filmed my daughter when she was like before this stuff started to kick in. But we've been doing it for about 6-8 months now. And I'm really seeing a huge difference in her ability to pay attention and listen to tasks and stuff like that. So hopefully we'll catch the emotional dysregulation stuff a little bit earlier. So the key thing with emotional dysregulation is remember that they feel emotions more quickly, they feel emotions more intensely, and they feel emotions for a longer duration. So then the question becomes, how can we train our child to restrain and be in control of their emotions instead of their emotions being in control of them? So I'm starting with a very simple emotion of fear. And this is where we start very, very small. So what I'm doing with my daughter, she's afraid of the dark. The challenging thing about training emotions is that I need her to feel the negative emotion, right? So in order for her to control anger, she needs to be angry. So the first challenge that I have is I don't want to make my kid angry, right? So I was thinking about how can I practice with her to help her restrain her anger? But that requires her to be angry in the first place. So do I want to do things that piss her off, like take away her toy or snatch things or punish or whatever? I don't want to do any of that. So this has been a little bit challenging, but I think I've sort of settled on one thing that seems to be working pretty well. I've done it for basically one day now. And that is we're going to start with fear because I still don't know what to do about anger. So what we're going to do with fear is she's afraid of the dark. So what we're going to do is teach her how to tolerate darkness for whatever amount that she can, and then we'll slowly extend it. So right now she can tolerate darkness for about 30 seconds before she gets scared. She leaves the room. She starts calling for us. So, this becomes really challenging during bedtime because when she gets ready for bed, she doesn't want to be alone in the room, even with the lights on. So what this sort of means for my wife and I is that if we tell her to get ready for bed, even though she can do it in less than 5 minutes, if we're with her and helping her, if we tell her, hey, it's time to get ready for bed, my older daughter who's neurotypical can do this fine. But what my wife and I find is that our ADHD daughter requires a lot more attention. And so my goal is not necessarily that I want to deprive her of attention, but it would be really nice if she could do things that, my older neurotypical daughter could even do at her age. So my younger daughter is now 6 years old, and my older kid could brush her teeth and go potty and change kind of on her own by the age of 6. So the question is, how do we train this? So what we're going to do is start with fear or anxiety. So what I tell her to do is she goes into her bedroom with the lights off, and I say, Daddy's going to be right outside, or I'll even ask her, do you want me to wait outside for you, or can I go downstairs and brush my teeth and come back or whatever? And then what I tell her is if she can tolerate 30 seconds, okay, I want you to wait 45 seconds before you leave the room. So her experience of this is that she's alone in the darkness for about 30 seconds, which she can handle, and then it gets to be too much. So now since she can handle 30 seconds, we can start with 30, and then eventually we want to go to 45, and eventually we'll go to 1 minute, and eventually we'll go to 75 seconds. And then we may even do things like I've started doing kind of a second phase of this, which is I want you to start brushing your teeth, and Daddy will join you in 15 or 30 seconds. And this is where I'll also ask her, do you want me to join you in 15 seconds, or do you want me to join you in 30 seconds? and she'll sort of tell me what she's capable of, right? So if she says, I want you to join me in 15 seconds, then I'll come in 15 seconds. And the whole point, though, is that as she becomes confident with 15 seconds, I project or predict that she'll be okay with me doing it in 30 seconds. And this is exactly what we want to do. We want to recognize that our children have a neurodevelopmental diagnosis, that their brains are wired a little bit differently. So we need to intervene with them in a way that compensates for that. In the same way that if a child has something like scoliosis, we need to give them a back brace so that their spine develops correctly. Or in the same way that a child has a stutter, so we need to intervene with speech pathology to help correct this kind of thing. There are particular neuroscientific challenges with ADHD. And if we understand what those are from a neuroscientific perspective, we can develop practices to train those capabilities. And as we train those capabilities, hopefully what we can do is deviate this course that is very, very scary for kids with ADHD of not having friends, doing poor in school. And the real challenge there is that the kid knows that they're just as smart as everybody else. And they know that these kids aren't smarter than me, and yet they still struggle. And that's when they really feel like something is broken inside me. And that's what really screws up their self-esteem. So can we alter the course of this? Now, for me, this becomes really, really important. So as a psychiatrist, I work with patients and I care about my patients. I would do a lot for my patients, but now we're talking about my daughter, right? So this is one of the most important people in the world to me. So for me, it's become like almost one of the most important tasks of my life that she has this brain that is different in these ways. And can I sort of protect her against it? I'm not trying to judge her for having it. But what I recognize is that her life gets better. She gets yelled at less. She forms more friendships. And those are the kinds of things that I absolutely want for her. So it's become incredibly important for me. And I've sort of taken everything that I've learned as both sort of a monk in training for 7 years, as a psychiatrist, as an addiction psychiatrist, as someone who works with a lot of neurodevelopmental challenges and diagnoses, that I'm sort of developing this thing because like now it's I know it sounds kind of weird, but it's become one of the most important things in the world for me. And what I recognize, what's so sad, is when I work with my patients, I sort of see that they didn't have these kinds of interventions. So then as an adult, they have fully developed brains. Now we haven't been able to shape the bonsai tree, which means now all of these things are not quite set in stone, but the brain is so much less neuroplastic as an adult. Right, so the concrete has kind of settled in a lot of ways, and it requires a lot more effort for my adult patients to start to create neuroscientific changes. So that's why we're going to try to start early, and I hope it works for my daughter. The reason I'm sharing this with y'all is because I've seen a lot of progress in about 6 to 8 months, and I hope it'll work for you too.